Hi everyone, welcome to my Friday night's live session. Today we have quite breaking news actually. We have Dr. Uma, who is an obstetric and gynecologist, who will be joining us to talk about Covid-19, its vaccines and pregnancy. Let me just invite. Hi Dr. Uma, I just invited you into the live session. Hi.
Hi. Hello. How are you?
Hi, Dr. Uma. I'm good. Thank you so much for joining us live. Hang on, let me just adjust my video. Okay.
Okay.
Yeah, so trying to get the full of my face in also.
How have you been?
I've been okay. Still in clinic, still at work.
Oh, wow.
So I can't I've got a couple of things up as well. So I'm so sorry, everybody who's wanted to join us at 8, but had a few things coming up, so I thought I'd just do a quick live. If anybody has missed this, you can always just watch it on my YouTube channel, the IGTV as well. So Dr. Uma, thank you so much for taking your time out of your busy schedule. I know how busy it's been for me to try to get you, and I'm so glad I got you today with all that's happening in the news at the moment with pregnancy and lactation and COVID-19 vaccines and all. So I know Dr. Uma for many years. I think it's almost 20 years, 15 years
Easy,
around. Okay,
easy.
many years, many.
That makes us old.
I know. I'm just gonna keep quiet about that. So, would you like to introduce yourself to everybody out there who's joining you?
Yeah. Hello, everyone. I'm Dr. Uma Mariappen. I'm an obstetrician and gynecologist. I also subspecialize in fertility, IVF, and reproductive medicine. Thank you for having me.
Thank you. Thank you so much, Dr. Uma. So I'll get straight into the couple of questions that I have. So what are the effects or complications of COVID-19 in pregnancy?
Okay, so COVID-19, we know it's actually coronavirus. So it's coronavirus, SARS-CoV-2 virus, right? And we know it affects the respiratory system as a whole. So it causes respiratory illness, especially infection. So respiratory infection is pneumonia. All right, and that can be quite severe and cause ventilation and even ICU admissions and even death. So in pregnancy, why are we so concerned? It's because in pregnancy, these pregnant women are in an immunocompromised state. So which means whatever effects that the non-pregnant population they get triple or quadruple the effects. Means they get a more severe form of the illness. So that means there's higher chance of getting severe pneumonia and getting admitted in ICU for mechanical ventilation. So that is what we're worried about, number one. Number two, we know COVID-19 causes venous thromboembolism, all right? So that's a known thing. But what happens in pregnancy is physiologically, these women are actually in a hypercoagulable state. So it just means that your blood is just thicker, it's more viscous in pregnancy, and that's physiological. So add on COVID-19 to that. So they have got double or even triple the risk of getting venous thromboembolism in pregnancy. So that's concern number two. And number three, if these women have already got medical illnesses that is already present, for example, they've got diabetes or they've got cardiac disease or they've got respiratory illnesses, COVID-19 just worsens it. It just makes it worse. So then they deteriorate faster. So these are the three main effects to the pregnant mothers that is actually exacerbated by COVID in pregnancy. All right. So that's pregnancy itself. Yeah.
All right. So when you say venous thromboembolism, it basically means blood clots in the veins.
In the veins, yes.
Right?
In the veins, usually in the legs,
Usually in the legs, and sometimes it can go up to your lungs, where we call pulmonary embolism, and that can actually cause sudden death in women. So this is I think it's physiological in pregnancy because God made it in a way that when you go into child labor, you shouldn't be bleeding to death. So God made the state, so women they clot easily rather than bleed faster. But with the virus in your body, it's not as, it causes more harm than it does in any beneficial way. But what about the baby then? So what can, because pregnancy is not just the woman alone. We want to know about the state of the baby. So what happens in a pregnant woman who's carrying a child, who's pregnant, obviously. So what happens to the baby if they get infected?
Okay, so at the moment, there's not much evidence to show that's vertical transmission to the baby. That means we don't have much evidence to show that if the mother is infected, the baby is going to be infected. But having said that, it's still a concern. So which is why my pediatric colleagues, such as yourself, would still swab the babies if the mother is positive or if she's highly suspicious of COVID-19, right? But in terms of the infection itself causing miscarriages or preterm birth or stillbirth, there is no hardcore evidence to show an association of infection doing that to the babies. So at the moment, there is no real effects except if the babies get infected with COVID-19, then obviously lung issues are the main concern.
Yes, correct, correct. But having said that, in this past 1 month, I would say I've seen 3 of my patients who are actually newborn babies that got the COVID-19 infection from the parents after birth. So delivered, came back home and then got the COVID-19 because, you know, one of the parents are still not working from home, still working in office and brought it back. So a newborn baby can get infected. At any age, you can get infected. So it doesn't mean that if the newborn baby is infected, it's from the mother itself. It can still be an external factor. Right. So what about pregnant women and COVID-19 vaccine? So should pregnant women get COVID-19 vaccine now that we know that they're considered high risk?
Yeah. Yes, yes, and yes. I can't say yes enough. I can't say yes enough. So basically,
so when is the best time and why?
Okay. So we, as I mentioned, you know, they tend to get the severe form of the illness. So obviously they're high risk, and we would advocate vaccination for pregnant mothers. We know that now. And the thing is, we've got 3 vaccines at the moment in the country. So we've got the mRNA vaccine, which is the Pfizer. And then we've got the viral vector vaccine, which is the AstraZeneca. And we've got the inactivated vaccine, the Sinovac, right?
Yes.
But all 3 vaccines are not contraindicated in pregnancy and breastfeeding. We know that, right? Yes. But the largest data set that we have with regards to pregnant women is the mRNA vaccine. So, which is why initially we decided and we recommended to only give Pfizer to pregnant women. But as of today, hot news from today, basically I think the ministry has decided to give all 3 vaccines to pregnant women because there is no real adverse effects from giving these vaccines. There's no reported bad outcomes so far. Right? So basically, we give this vaccine, it's recommended to be given from 14 weeks of gestation to 33 weeks of gestation. Okay? So why 14 weeks? Why 14 weeks, you may ask. So basically, the first trimester is where the embryogenesis happens, which means the fetus is being formed. The embryo is being formed, the vital organs are formed. So it's crucial at this point not to intervene with any form of, you know, external factors that we don't know much about. So usually any form of intervention in the first trimester, we are usually quite apprehensive being, you know, OBGYN. So we start from early second trimester, 14 weeks to 33 weeks. So this is basically with regards to the first dose. So if you've received your first dose at 33 weeks, for instance, you still got like another 3 weeks for your second dose, and you still be able to get it before you go into labor. So that's the whole idea of giving it from 14 to 33 weeks.
Okay, so what if they do go into labor prematurely? Like, so if they get it at 33 weeks, and just say for whatever reason they go into labor at 37 weeks instead of the usual 38 onwards, do you give the vaccine after that? Do you still give a second dose after delivery?
Yeah, so we do give the second dose after delivery. So it's usually 6 weeks postpartum. So it's in the puerperium. So after the puerperium, 6 weeks postpartum, they can get the second dose.
Okay, so does the vaccine cause any issues with, like you said, does it affect the fetus? You know, you did mention embryogenesis, so we're not going to go into the first trimester because we don't want to mess around with, you know, because in case, and we all know about maybe 1/3 of pregnancies actually end up in a miscarriage. It's just that we don't realize because, you know, we naturally just miss a period and then we don't realize that we were actually pregnant and had a miscarriage. So we don't want to interfere with that natural process. So that's why we try not to interfere with first trimester. So does the vaccine given in the second and a little bit of third trimester cause any issues with the fetus, or does it cause premature delivery?
Okay, so the recent evidence and whatever studies that has been done, right, there is no association with increased miscarriages, even second trimester miscarriages, preterm birth, stillbirth, and neonatal death. So there has been no causal relationship between the vaccine and these outcomes. So studies are still ongoing. We know that the evidence is evolving, but at the moment there is no substantial evidence to prove that. So it's actually quite safe.
Okay, all right. Yep. And what about breastfeeding? Can the COVID-19 vaccine affect breastfeeding? Because I know a lot of my patients' mothers, they're always curious whether they can continue breastfeeding, they should be breastfeeding. If they've taken the vaccine, should I pump and dump? You know, what should they do?
Okay, so even in COVID-19 positive patients, right, we don't discourage them from giving breast milk. So so at the moment the evidence is there is no harm in breastfeeding. Even after vaccination, please continue breastfeeding. They have in fact found antibodies in the mother's milk, which they hypothesize that, you know, perhaps the baby could have passive immunity, some sort of immunity, but they still don't know how much or how effective it is. But definitely no harm in breastfeeding after vaccination.
Okay, and just to add a note there was actually a study done among COVID positive mothers who delivered, and they found that the chances of the baby getting COVID positive were higher in the non-breastfeeding mothers, you know? So breastfeeding, like you mentioned, when you are COVID positive as a pregnant mother, you probably have already developed some antibodies. And they hypothesize that maybe some antibodies have actually gone into the baby as well. So if you breastfeed, so if you breastfeed, it gives higher protection to your baby. So just maintain your SOP, wear a mask, wash your hands, you know, and then in between the breastfeeding, try not to handle the baby too much, those kind of things. Sorry, there's a question in the comment section by Eliza. She says, there's a belief going around that if a person gets COVID, the same person cannot get it again. Is this true? I'm sorry, Eliza, but that's not true. You can get COVID. You can get COVID even if you've had it the first time. And in fact, there is such a thing called long COVID, where you have long-term symptoms of COVID. I'll discuss that in another live session later on. And another one, my niece was COVID positive, now cleared, then found out she's pregnant 3 months.
So 3 months post-COVID, right? So usually, I think at the moment, the guidelines say you either get it post-delivery or 6 months after an infection. So they've given a 6-month period after an infection to get vaccinated, because you can still get an infection, reinfection after you know, getting infected once. You can still get a reinfection. So the guideline says that wait for 6 months because they still do not know what, as you mentioned, the long-term effects are, and then, you know,
this is for
get
pregnancy,
vaccinated.
is it?
This is for pregnancy.
This is for pregnancy.
Yeah.
Oh, okay. Because for the non-pregnant population, if you are COVID positive, they say to wait 3 months.
3 months
from the date that you 3 months. I didn't see 6 months for pregnancy though.
But for pregnancy, I think there is no real clear guidelines, so it's still general. So it still says 6 months as with the non-COVID, but they still haven't said, you know, COVID positive, now pregnant, how long do you wait? I don't think there's actually a real timeline there yet.
So we probably have to follow the 14 to 33 weeks,
14
and as
to
long
33
as the mother
maybe.
is well, you can still get your vaccines during those periods.
The thing is, how long after an infection, we don't know. What if it was just 2 weeks or 3 weeks prior to getting pregnant? Then do you get a vaccination in, you know, 14 to 33 weeks is a bit too short. So we still do not know what is the real duration yet, I think. So that's still being, you know, studied.
Investigated. All right. Okay. So you've already said that vaccine is safe during pregnancy and lactation. We should not pump and dump. So what about someone who's planning to get pregnant? You know, like just got married, want to do IVF, for instance, or, you know, what about those group of people? Should they get the vaccine first or get pregnant first?
Okay, I get like 10 calls a day regarding this actually in my clinic. So probably more. So basically the question is, you know, I'm going to be doing an IVF cycle. Do I get my vaccine first or not? The answer is yes. In a pandemic, it's always, you know, getting your vaccines and protecting yourself first. So if you haven't started your fertility treatment, if you are not in a cycle yet, then get your vaccines first, okay? Because it's only going to take you 3 weeks, from the first dose and then your second dose and you're done.
Yeah.
So
Yeah.
initially there were concerns about, wait, after my vaccination, how long do I wait? Do I wait for like 1 month, 2 months? Is there an interval before I start my treatment? So the latest evidence suggests that you actually just have to wait out a few days until your immune system settles down, and then you can start your fertility treatment. So there is no waiting period there, right? So basically, if you are going to start treatment, just defer for a month, get your vaccination sorted, and then you can start your treatment. But what if you are in cycle? What if you are already being stimulated for an IVF cycle? Then obviously you would have to complete that first, complete your IVF cycle till oocyte pickup or an embryo transfer or a freeze cycle, whatever it is. And then you can go for your vaccination. Okay. But if you have already completed your cycle, say, you've just done your embryo transfer and everything's good, perhaps you wait for your 2 weeks to see first whether you're pregnant, because you've got that 2 weeks interval to test for pregnancy. If you're pregnant, then again, the 14 to 33 weeks apply. But if you're not pregnant, then go ahead and get your vaccine.
Okay, all right. So for those who are planning and they have not done anything yet, the advice is still get your vaccine first so that you have a safer body to maybe hold on to a baby at a better, at a better way. So if your body is weak and you get infected during your cycles, and IVF, touch wood, I didn't have to go through it, but I know of a lot of friends who are going through IVF, and it's not something that's very cheap. Whether it's done in the government or private sector, it is something very expensive. So you don't want to risk spending thousands of dollars, and and you get stressed because of the IVF, you get stressed of the vaccine. So finish off the stress of the vaccine, get it over and done with, then calm your head down for your IVF to go on safely. So that's just my tip as a mother, not as an obstetrician, but otherwise follow what Dr. Uma says, Yes,
please get your vaccines and then start your cycle.
And then, are there any contraindications to getting the vaccine for all these pregnant or lactating mothers?
So basically, contraindications would be the same as a non-pregnant population. So I think the only real contraindication is if you've got severe allergies or anaphylaxis, right, to any multiple class of drugs, or basically to any other vaccines, or if you're allergic to the ingredients in the COVID-19 vaccine itself, which is the polyethylene glycol or polysorbate ingredient, right? So if not, if you are under the category of, say, immunocompromised patient, if you are, say, a heart patient or a kidney patient or a liver patient, or if you've got bleeding tendencies, or any form of mild to moderate allergies, even to antibiotics or such, right? Just get a pre-vaccination assessment done by your physician, right? So just go to your treating doctor, wherever it is, in the clinic kesihatan or the hospital, get the doctor to actually assess you, so she or he can actually tell you when to get the vaccine, number one, and number two, where to get it, whether you can actually get it in the vaccination center, or you need to go to a hospital, because you probably need backups and stuff like that. So other than the real contraindication for anaphylaxis, I think the rest of the category of patients will just need an evaluation and then go ahead and get your vaccines.
All right. We've got one question in the comment section. There's an advice to stop breastfeeding for 1 week post-vaccine. Is it true? We just spoke about this earlier. No, you don't need to stop. Don't waste your precious golden breast milk. Don't waste it.
Please don't dump it. Please, no.
Yes. Yeah. Don't make it into soap. Feed your baby with precious golden milk.
Yes. So you can continue breastfeeding right after vaccination. Come home from the center, wherever, just continue breastfeeding. Don't stop.
Mandi dulu, bathe first. Bathe first, clean yourself, then breastfeed. Maintain the SOP still. Right. So any messages to women out there in general who, just in general, who want to be pregnant, who are breastfeeding, and, who you feel as an obstetrician might have certain concerns, is there any advice for these women?
Okay. So basically, I think at the moment, a lot of confusion is among whether, pregnant ladies can be vaccinated and breastfeeding mothers can be vaccinated. Answer generally is yes, right? So if you're pregnant, please get vaccinated from 14 to 33 weeks of gestation. Even if you got your vaccine and you didn't know you were pregnant and a week later you tested positive, don't worry. There is no evidence of the vaccine causing fetal abnormalities. Okay, so go ahead and get your second dose after 14 weeks. And for breastfeeding mothers, no issues. You can actually get your vaccines and continue breastfeeding. So my advice is please get your vaccination. I think that is our only weapon against this pandemic at the moment.
Absolutely. I mean, I absolutely agree. Being pregnant itself is not easy. And I think coupled by if a woman has got, like you said, medical problems like diabetes, hypertension, or even heart disease, or any other immunocompromising disease like rheumatoid arthritis and all that. So that's like double disease. And then you've got a whammy of COVID-19 coming in. It's just too much. I mean, for a woman to go through all that, I think it's just too much. Take care of yourself. Get yourself vaccinated first. And then you'll be able to take care of yourself, your pregnancy, and the baby once the baby comes out.
That's right.
Absolutely, yeah. And yeah, I think if you're scared, get your husbands to get the vaccine first. So at least you know your husband is safe and won't bring any harm to your newborn baby. So vaccinate anybody around. If you're living in a joint family, grandfathers, grandmothers, uncles, vaccinate them because you don't want them to bring back the disease to your newborn baby as well. So have a cocoon protection for them. Thank you so much, Dr. Uma. I think this was excellent. I hope this has been helpful to everybody who's joined in. If you've missed any of the beginning parts that we talked about, how COVID-19 can affect pregnancy and lactation, or any of the information that Dr. Uma has shared with us, please look up the IGTV. It will be saved there, or my YouTube channel, Dr.RakheeYadav, and it's all saved onto there. So take care, everybody. Get yourselves vaccinated. Register. Make sure your information is all correct on your MySejahtera. Thank you so much, Dr. Uma.
Thank you. Take care. Bye-bye.
Bye. Take care. Bye.
Bye.
Bye.